Welcome back to Valley Life. I'm Alicia Safias, and we are back with Dr. Nizami from the Pacific Medical Center of Hope. Welcome.
Thank you very much for coming.
Now, when we talk about cancer treatments and cancer patients, it's not usually a place where we would think of coming in and seeing smiles on people's faces, but you kind of make that happen. Tell us about what you do here.
Yeah, I have been able in the last few years to invent a new protocol to treat cancer. Patients who come here, they travel across the country to get here just by hearing my name, by the word of mouth, and seeing the good results in my patients. I can't say enough good responses that I see in my patients is beyond any expectations. My patients usually have failed the conventional treatments, the traditional ways of treating cancer, and when they get here, they find these treatments non-toxic with no side effects and with great efficacy.
It is true. When you look at the patients here, they seem to kind of have a glow. When you talk about traditional forms of treating cancer, you know, we associate that with very negative side effects, and you advocate both forms of treatment, correct?
That is correct. Our treatments actually work very synergistically with conventional treatments. We have completed the in vitro studies that show that these therapies work in conjunction and synergistically with most of the chemotherapies. And the results are actually beyond what they expect in vitro in the lab.
Now, we're about to meet a patient. Her name is Jean, and she tried conventional forms of treatment for her cancer. Give us a little bit of the background of her, and then we'll meet her.
Absolutely. Jean came here with advanced stage 4 metastatic breast cancer that has already failed to the IPT, insulin potentiation chemotherapy. She had used several agents of the chemotherapy unsuccessfully, and unfortunately her cancer was getting worse each time that she was using chemotherapy. This time she comes here and she starts on the epigenetic therapies. After I reviewed the genetic formulations of her tumor, I formulated the treatment for those genes, and she started the treatment. Her cancer, in a matter of just a few weeks, started to respond. Now, as we speak, we just received her results that show that the labs have significant improvement. The scan confirmed the shrinkage of the tumor, and the activity of the tumor has dropped significantly. The tumor markers have dropped more than 80%, and she's looking for a full remission.
That's wonderful. And she actually came from Texas, and we can go into the room here. And I just saw tears in your eyes, Jean. You got some amazing news.
Yes, I did. The circulating cancer tumor cells are 0 of the blood test that was taken last week.
I mean, you come here to get hope. There's hope in the title here, and that's exactly what you've gotten today. You've been here for a few weeks, and then you got the news you've been waiting for.
Well, I had hope when I came here because I had heard him speak, and it's really quite miraculous. The chart that you filmed out there was those are my cancer markers. They've come. It's like a 45-degree downslope. It's really quite miraculous because the cancer had spread significantly.
A lot of people question. They say, "How can you treat cancer without, you know, doing the chemotherapy and the radiation and those things?" But tell people what they need to know out there who are maybe considering alternative treatment.
This really works better. The cancer had spread from my breast to the pleura, which is the lining of the lung, which is exceedingly difficult to treat, and to my bones. And when I had the PET scan a month ago, it was significantly reduced, even in the pleura, which is like miraculous. And I fully expect to be cancer-free in the not-too-distant future. His treatments are beyond what anybody else is doing, and it's all scientifically based.
And aside from just the physical cure that you're going through right now, explain the emotional part of this, knowing that there is hope.
Well, you know, stage 4 is very frightening, and there weren't many options left open to me. Dr. Nizami was it. And so when I came here, I didn't realize that the cancer had spread quite as significantly as it had. I knew it had spread to the pleura. I had like 16 months to live when I came here. And it's truly, and that was the first week of August, that it's truly, I'm going to live. probably a lot longer. So it's hard to even put it into words.
Oh, we are so thankful that you shared your story for us, Jean. Congratulations. Thanks again. Again, Pacific Medical Center of Hope, really providing hope for treating cancer. And Valley Life, we'll be right back.